Hello, I'm Dr. Stephanie Munoz. I serve as the research director at Southern California University of Health Sciences in the United States. I'm presenting this on behalf of myself and Dr. Melissa Nagare, the Chief Whole Health Officer at SCU. The presentation entitled Transforming Health Professional Education, the Whole Health University Model at SCU. As many of you already know, the healthcare system in the United States suffers from tremendous and rising costs and yet worsening outcomes. And at the same time, we're experiencing a provider burnout crisis. In alignment with recommendations from the WHO and the US National Institutes of Health, we recommend that education for clinicians be aligned with integrative care, preventative focused care, and patient-centered care. Enter the model of whole health from the US Department of Veteran Affairs, which is the largest healthcare insurer in the United States and a single payer model that has focused at its center on the meaning and purpose of the individual patient. This model has been associated with improved satisfaction, reduced opioid use, and enhanced workforce well-being. This is an example of how insanely expensive the United States healthcare system is, and yet we have some of the worst outcomes among similar nations. And that goes to mental health as well as physical health. Patients can't afford their care and therefore skip it. And we see a burnout among physicians that results in a reduced workforce compared to the need. So, what is whole health and what are the components of a whole health system? The purpose of whole health is to optimize health and healing for the individual to live a more meaningful life. And that includes three components of empowering the individual, equipping them with skills, and providing appropriate care. The locus of control moves from an expert model to centering on the individual and what matters most to them. The context for the proposal of a whole health university is Southern California University of Health Sciences, which is in California. And it includes embedding a whole health framework outside of the clinic alone into the university setting in the academic programs, clinical programs, and the university culture writ large in order to change the way that health professional education occurs. We conceive the Whole Health University as in alignment with whole health care, the care that is provided to patients in collaboration with them, a whole health life, which are the choices that an individual makes in order to facilitate their own well-being, and training the future clinicians through a whole health university model. Our objectives with the Whole Health University are to infuse the culture and the concepts of whole health in the clinical training and academic training of our students, but also in the university as a whole, so that our students have a lived experience of whole health and learn in a healthy manner themselves how to deliver whole person care in alignment with the quadruple aim, which also aims to reduce clinician burnout. So SCU is implementing a 3-year plan that includes training our students, faculty, and staff in the model of whole health, in the curricula, in the clinic, and across the campus, and evaluating the feasibility, accessibility, and early impact of that rollout. We're engaging students, faculty, and staff across all of our academic programs and departments. So far, we have been able to get to leadership alignment across these sectors. We've done some awareness building across the campus. We've launched a 3-year whole health training program for the entire community and designed a framework to evaluate it. We have identified some potential challenges, including some resistance to added workload, potential for competing priorities, the need for investment in training and coordination, the complexity of bringing whole health across all of our different sectors, and that it'll take some time to build up a meaningful base of evidence. Despite those challenges, we think this is an opportunity to improve healthcare and healthcare education. Our key recommendations for those wanting to follow the model of a whole health university is to engage leadership from the beginning, involving all of the stakeholders at the institution in a transparent fashion, creating a structure that allows you to not only implement this, but also measure how it's going along the way. Notice where there may be potential for resistance and proactively address those issues and address them as they arise, and embed the whole health model into all sectors. So there's a shared culture and a shared understanding of this model. We're still in development, but we hope that this may provide a model for other institutions to follow suit and align the university experience with the model of whole health. This is the roadmap that SCU has adopted for moving forward over the next several years as we become a whole health university. Thank you.